What is whole body cryotherapy and how can it help you recover from workouts or recover from injuries? I'm Dr. David, orthopedic surgeon and sports medicine specialist, and I want to help you feel and perform your best regardless of age and any injuries you have. Now, whole body cryotherapy is something near and dear to my heart because I've been doing it now for about 8 to 9 months. Yes, this is the big cryo tanks that you hear people talk about where they get in these chambers and it's really cold for 2, 3, 4 minutes. And I'm going to show you my going through it here in just a minute. But what is it? All right, so that's right. It's cold exposure for a very short amount of time. Very cold, 110 degrees Celsius, below zero, or sometimes more than that. And it gets the skin really cold. It circulates really cold air, and I think in mine it's liquid nitrogen or it's a nitrogen tank. And you basically expose yourself to that for about 3 to 4 minutes. And it's thought to help with pain, it's thought to help with inflammation, edema, essentially muscle swelling. And so people, especially elite athletes, we hear a lot about pro athletes doing it, and then kind of weekend warriors and active adults like me have been really getting into it as well as a muscle recovery treatment. Now, there's conflicting data out there about how effective it really is. There was a study in the International Journal of Sports Medicine that showed that it decreased muscle pain by about 80%, or in 80% of the people that did it. And then some sort of conflicting studies, if you read other studies, about when they look at markers of muscle breakdown. Is it actually better among people that do the cryotherapy compared to people that also work out and don't do it? And so there's a lot of conflicting data. There's what we call a Cochrane review, which is this organization that does reviews of all these studies and pulls all the numbers together to see if there's a real benefit. And they have shown that there doesn't seem to be that much of a benefit. I will tell you that not just me, but talking to tons of people that have done this, not just at my place, but at lots of them, people really seem to feel like it helps. And that gets to one of the challenges with doing scientific research for all sorts of recovery treatments, not just whole body cryotherapy, is it's really difficult to do these studies and really prove a benefit of something like cryotherapy compared to, say, controls, basically placebos, for two reasons. One, you know if you're getting the treatment or not. We try to do studies where they're double-blinded, where the person doesn't know they're getting a treatment and the study investigator, the researchers, don't know if that person's getting it either. But in whole body cryotherapy, you're standing in a cryo tank, so you know if you're getting it or not. Plus, a lot of people expect a benefit. They go into it expecting one, so when they feel better, they assume that that's a real phenomenon. The other challenge is that so many of these studies for whole body cryotherapy cause what we call perceived benefits. But again, the muscle breakdown markers and that kind of thing, the objective measures of recovery aren't that much different. But my thing about perceived benefits, and I know people call that a placebo effect, but if you actually feel like your muscles feel better after doing whole body cryotherapy and that you're less sore going into your next workout, then you're probably going to perform better in your next workout, which is the whole point in the first place, is to recover to do a better workout next time. So even if it doesn't change the muscle breakdown levels and things like that, there may be a benefit to perceived benefit to whole body cryotherapy. What I would say is, if you're interested in it, if you work out a lot, if you run, you do triathlons, you do all these boot classes, CrossFits, boot camps, Orange Theory, Red Zones, all these types of things, and you want to try to get over some of the delayed onset muscle soreness and get ready for your next workout, try it. These are all over the place now. You can find places that do cryotherapy in about every town. So now let me show you just what it entails. All right, give him the robe. If you want to go ahead and close that, I'll get the gloves on. All right, so this is whole body cryotherapy. Basically, 3 minutes in a chamber at what, negative 187 degrees. I assume that's Fahrenheit, or we'd be in that's Celsius. Wow, so it gets pretty darn cold. Now, sometimes it feels a lot colder than others. Depends on if a lot of people have been in this before, or if there's been a gap between me and other people that have gone. Also, some days you just come in here and maybe it's after a workout and it's pretty brutal, and then some days it's not so bad. but it's acquired. So at least here, and every cryotherapy place might be a little different. In theory, you could stop before 3 minutes. So the first time you're doing it, if you at 60 seconds you're really cold, well then stop, and then the next time do a little bit more. But try it for up to about 3 minutes. And, just anecdotally, and I know this is not research, but the days that I do it, I do feel like I sleep better those nights. I feel like muscle recovery after hard workouts, that I do feel a little bit better the next day. I don't know, is that real or is that just a perceived benefit because you know you did this and you suffered for 3 or 4 minutes? Maybe, I don't know. I will tell you, as somebody that's also trying to start taking cold showers, I think this is actually a little bit easier. Yes, it's brutally cold, but it's air, it's not cold water. So I think that, I don't know, a little easier to do. Now, what I'm not doing real well right now that I should be is spinning a little bit so that I don't just constantly get all the cold in one area. I guess in theory you could get a frostbite. Something else I've learned, in case you're new at this and you want to go try it, is if you're just coming from the gym, don't wear the socks that you wore to the gym in here. Switch into some dry socks because your feet sweat. And let me tell you, that little bit of dampness on your feet gets brutally cold. So something I think that can be really, really important here. So far this hasn't been so bad. What are we at time-wise?
I got about 39 seconds left.
Yeah, so I mean it goes really fast, especially if you have the people that work there, or you come with a friend and you talk the whole time. It really, really is not too bad. It's something worth trying. Yes, I know there's debate about the scientific merit of this, but I think that give it a try. If you've got some medical condition that you're not sure if it's right for you, then yeah, maybe talk to your doctor, but see how it goes. If you're like, I did it and I didn't feel that great, great, you never do it again. But if you come out and you're like, wow, I really feel better after my workout, I think it may be worth something you do. I'm a member here, so I think it can be really helpful. Was that it? That's already 3 minutes? See, really not so bad. All right, if you have an experience with whole body cryotherapy, I'd love to hear it. Leave that in the video below, or in the comments to the video below. Check out my other videos on all sorts of great recovery tips to help you get stronger, recover from workouts, and recover from injuries. And I look forward to seeing you right here next time.